Hello everyone, and thanks for watching. This is your 5-minute edge on youth mental health. This video was made possible through a partnership between the Wisconsin After School Network and the Wisconsin Department of Children and Families. I'm Carly Doty, a social emotional learning specialist at the Boys and Girls Club of Portage County, and I'm excited to talk to you today about mental health trends and how to combat stigma. Both national and state data highlight alarming trends around the increase of mental health challenges for children and youth. In 2019, for example, 1 out of 3 high school students reported persistent feelings of sadness or hopelessness, and these figures are believed to have only increased since the pandemic. Suicide rates are also on the rise. According to the Wisconsin Department of Health and Human Services 2020 statewide health assessment, 16% of Wisconsin youth surveyed had seriously attempted suicide, and suicide was the 5th leading cause of death among children aged 5 to 14. Out-of-school time programs in Wisconsin are positioned in a place where they have a unique opportunity to provide front-end mental health intervention through quality programming and support. They also have access to families and the whole child support system in ways that school staff or traditional mental health providers do not. There is a potential in these settings to combat many of the stigmas kids and families face around mental health. What is stigma, you may ask? Stigma is a negative connotation associated with a specific quality or identity. One example commonly heard in the mental health realm is individuals who struggle with depression or lazy. People surrounding the individual might notice that they are struggling with basic hygiene, daily responsibilities, etc. What they aren't noticing is the ongoing battle within the individual's head that is taking up the majority of their energy, in turn making it harder for that person to put in the needed effort with other tasks. Now you may be wondering, how can we reduce stigma towards mental health? The solutions are relatively easy. Number 1, educate yourself. Take the time out of your schedule to find new ways to learn about mental health, the different illnesses, common symptoms, and ways to help. It can also be as simple as listening to someone else's experiences and stories. Mental health manifests itself differently in each individual, so it's important to understand how it could affect everyone differently. Number 2, educate others. When you hear stigmas of mental health appear, take the time to educate the individuals on the topics. Educate the importance of their language and how using illnesses as adjectives can be harmful. Gently insert yourself into educating why certain jokes are furthering stigmas or overshadowing individual struggles. Also, educate those who are struggling by helping them find resources or solutions. Number 3, openly talk about mental health. Having the conversation decreases the taboo or discomfort. It opens up the ability for others to talk to you about their stories and know that you are a safe person to go to. The more mental health is talked about, the more willing others are going to be about sharing their stories or recognizing the personal struggles they could be facing. Number 4, choose compassion and empowerment. A symptom of most mental health illness is self-discrimination. By reminding those who are struggling with these illnesses that they deserve to be loved and empowered to be themselves, you are giving them the space and ability to create the language for themselves. Simply showing kindness can turn someone's entire day around. Mental health is a pandemic across America. It is possible to create the space for positive and empowering conversations. We offered some solutions. Now it's time for all of us to put them into action. Together, we can reduce the stigma standing against mental health.